Dr. Sandoval, I'm trying to get my head around this one, but I want to double check I'm understanding what it's asking for at the end. The problem is, the 32-week gestation, 1.9 kilogram neonate has been prescribed IV ampicillin for concerns for sepsis. The dose is 150 milligrams per kilogram per day, divided into 2 doses administered over 15 minutes. The pharmacy dispenses the medication in a 5 milliliter vial that contains 250 milligrams of medication. At what rate will the nurse program the medication to infuse? Round your answer to the nearest 10th decimal. Is it asking for the rate in milliliters per hour or milliliters per minute for this infusion?
This problem's wording can be a bit tricky, Priya, especially with how the dosing is broken down and the final rate unit. It's a very common point of confusion that we should clear up right away. Since the question asks for the rate the nurse will program the medication to infuse, we're looking for an answer in milliliters per hour, as that's how infusion pumps are typically set. Now, to start, what information do we have and what are we trying to find? Then, what do you think would be the very first step in tackling this problem?
Okay, so we know the neonate is 1.9 kilograms, and the dose is 150 milligrams per kilogram per day, divided into 2 doses, each given over 15 minutes. The pharmacy vial has 250 milligrams in 5 milliliters, and we need to find the rate in milliliters per hour. I think the first step is to figure out the total dose for the patient per day. So 1.9 kilograms times 150 milligrams per kilogram per day. I got 285 milligrams for each infusion, right?
You're absolutely on the right track with finding the total daily dose, Priya. The calculation of 1.9 kilograms multiplied by 150 milligrams per kilogram per day, giving 285 milligrams, is correct for the total amount of ampicillin for the neonate for a full day. This is a great start on the weight-based dosing. However, the problem mentions the dose is divided into 2 doses. How does that affect the amount in each individual infusion?
Oh, right. I got the total daily dose, not the dose per infusion. So if it's 285 milligrams for the whole day and it's divided into 2 doses, then each infusion would be 285 milligrams divided by 2. That would be 142.5 milligrams per dose. Is that correct for each infusion?
Yes, that's exactly right, Priya. You've correctly calculated the individual dose for each infusion. So 285 milligrams per day divided by 2 doses gives us 142.5 milligrams per dose. Now that we know how much medication is needed for a single infusion, what should we do next? Considering the medication is dispensed in a 5 milliliter vial containing 250 milligrams.
Okay, so we have 142.5 milligrams for one dose. The vial has 250 milligrams in 5 milliliters. I think I need to figure out how many milliliters that 142.5 milligrams would be. So, if I do 250 milligrams divided by 142.5 milligrams, and then multiply that by 5 milliliters, I get 8.77 milliliters. Is that how I find the volume for the dose?
You're on the right track with using the drug concentration to find the volume, Priya, but let's re-examine the setup of your ratio. You want to find out how many milliliters correspond to 142.5 milligrams. Think about the units. If you have milligrams and you want to end up with milliliters, how should the 250 milligrams and 5 milliliters be arranged in your conversion factor to make the milligrams cancel out? Can you try setting up that ratio again?
Oh, I see. I had the ratio upside down. So I need to multiply the dose by 5 milliliters, 250 milligrams, to get the milligrams to cancel. Let me try that again. It would be 142.5 milligrams multiplied by 5 milliliters divided by 250 milligrams. I got 2.85 milliliters. Is that the correct volume for one dose?
Excellent, Priya. That's precisely how we set up the unit conversion. Multiplying 142.5 milligrams by 5 milliliters divided by 250 milligrams gives you 2.85 milliliters, which is the correct volume for one dose. You've correctly converted the dose in milligrams to the volume in milliliters. Now that we know the volume to be infused for each dose, and we know each dose needs to be administered over 15 minutes, what's our next step to find the infusion rate in milliliters per hour?
Okay, so I have 2.85 milliliters for one dose, and it needs to infuse over 15 minutes. To get the rate in milliliters per hour, I should divide 2.85 milliliters by 15 minutes. So, 2.85 divided by 15 equals 0.19. Does that mean the rate is 0.19 milliliters per hour?
You've done the division correctly, Priya, and 0.19 is the correct value if you were calculating milliliters per minute. However, remember, we need the final rate in milliliters per hour for the infusion pump. How many hours are in 15 minutes? Think about converting that time unit before you do the final division. Say the unit aloud as you write each number down.
You're right. I forgot to convert the minutes to hours. So 15 minutes is 15 divided by 60, which is 0.25 hours. Then I take the 2.85 milliliters and divide that by 0.25 hours. That gives me 11.4 milliliters per hour. Is that the correct rate?
Yes, that's absolutely correct, Priya. Converting 15 minutes to 0.25 hours and then dividing 2.85 milliliters by 0.25 hours indeed gives you 11.4 milliliters per hour. Congratulations, you've solved the problem. To summarize, we first calculated the total daily dose, then found the individual dose per infusion. Next, we converted that dose into a volume using the medication's concentration. And finally, we calculated the infusion rate in milliliters per hour by dividing the volume by the infusion time in hours.
Oh, that makes so much sense now. Thanks so much, Dr. Sandoval. I kept forgetting to convert the time to hours, and I mixed up the ratio earlier. It's really helpful to break it down step by step like that. I feel much better about this now.